As we grow older, regular doctor visits become a crucial part of maintaining good health. However, there are certain things that many elderly individuals unknowingly say or do during doctor's appointments that could hinder their health or lead to unnecessary complications. What we say to our healthcare providers can impact the quality of care we receive, and as we age, it's essential to be mindful of how we communicate. In this video, we're diving into 5 ugly truths about how seniors should communicate with their doctors and why avoiding these common mistakes could improve your health and well-being. Understanding how to speak to your doctor effectively is key to staying healthy in old age, maintaining independence, and ensuring that you're getting the best possible care. Let's explore the 5 things you should never say or do at the doctor's office as you get older and the best ways to improve your communication. 1. I'm fine, everything's okay. Don't hide symptoms. One of the most common things elderly patients tend to say when they visit the doctor is, "I'm fine," or "everything's okay." While it's understandable that you might want to avoid worrying your loved ones or your healthcare provider, hiding symptoms is never a good idea. Ugly truth. When you say, "I'm fine," you may be masking underlying health issues that could be addressed early, preventing serious complications. Ignoring early signs of things like heart disease, diabetes, or even cancer can allow conditions to worsen. A survey conducted by the National Institute on Aging found that many older adults delay seeking medical attention for symptoms due to fear of being a burden or being labeled as sick. Scientific Insight, a study in the Journal of the American Geriatric Society, revealed that elderly patients often underreport symptoms such as fatigue, pain, or memory loss. This lack of communication can lead to misdiagnosis or delayed treatment. Seniors who fail to disclose their symptoms can miss early intervention opportunities, which can be vital for treating chronic conditions and maintaining a healthy life. Actionable tip: be open and honest with your doctor. If something feels off, whether it's persistent pain, difficulty sleeping, or a sudden change in mood, make sure to mention it. It's better to be thorough and proactive than to ignore potential warning signs. 2. I don't want to take any medication. Don't reject prescribed treatments outright. It's common for seniors to feel overwhelmed by the number of medications they're prescribed, especially as they age. Some may even refuse to take medications altogether, fearing side effects or simply not wanting to rely on pills. However, rejecting medication without discussing it with your doctor could be a serious mistake. Ugly truth: not taking prescribed medications can have severe consequences. The American Heart Association reports that up to 50% of patients over 65 don't take their medications as prescribed, often leading to worsened health outcomes like hospitalizations or even death. Chronic conditions like high blood pressure, diabetes, and arthritis can become unmanageable if medications are skipped or stopped. Scientific Insight. Many medications for chronic conditions are designed to manage symptoms, prevent disease progression, or improve quality of life. For instance, not taking blood pressure medication could increase your risk for stroke, heart attack, and kidney failure. A study in the American Journal of Managed Care found that proper medication adherence in seniors leads to a 50% reduction in hospital readmissions. Actionable tip: if you're worried about side effects or the number of medications you're taking, discuss it with your doctor. They may be able to adjust the dosage, change prescriptions, or explore alternative treatments that suit you better. But never stop medication without professional advice. 3. I don't need a second opinion. Always seek clarity. As we age, we often trust our primary care doctors and rely on them for all our medical needs. While this is fine in many cases, it's essential not to shy away from seeking a second opinion, especially if you're facing a serious diagnosis or complex treatment options. Ugly truth: Many older adults fail to seek second opinions because they don't want to trouble anyone or seem distrustful of their healthcare providers. However, in some situations, getting a second opinion can make all the difference in receiving the best possible care. The National Institute on Aging highlights that older adults often hesitate to seek second opinions due to a lack of confidence in questioning authority figures like doctors. Scientific insight. According to a study in the Journal of the American Medical Association, second opinions can lead to better diagnoses and treatment plans. In fact, it was found that about 12% of patients who sought second opinions after a cancer diagnosis had their diagnosis changed, potentially saving lives. Actionable tip. If you're faced with a significant diagnosis or complicated treatment decision, ask your doctor for a referral to another specialist or seek a second opinion. You have the right to be confident in your healthcare choices, and multiple perspectives can ensure you're on the best path. 4. I don't understand, but I don't want to ask. Don't be afraid to clarify. It's easy to feel embarrassed when you don't understand medical jargon or the doctor's explanation of your condition, but failing to ask questions can lead to confusion and mistakes. Too often, seniors nod in agreement when they don't fully understand, which can affect the treatment process. Ugly truth. Not asking questions or clarifying instructions can result in misunderstanding your treatment plan, missing important information, or even using medications incorrectly. Research from the American Medical Association shows that nearly half of older adults have difficulty understanding medical instructions, and this can lead to non-adherence to treatment plans. Scientific insight. A study from the University of California found that patients who actively engaged in conversations with their doctors and asked clarifying questions were better at following through with treatment regimens and had better health outcomes. It's important to have a clear understanding of your diagnosis, treatment options, and medication instructions. Actionable tip. If you don't understand something, speak up. Ask your doctor to explain in simpler terms, or ask for written instructions that you can refer to later. Don't leave the office without a clear understanding of what's going on with your health. 5. I'll just wait it out. Don't ignore symptoms and wait for them to go away. When faced with new or worsening symptoms, many seniors dismiss them with the mindset that they will just go away or it's nothing to worry about. While this attitude might seem harmless, it can lead to serious complications when it comes to conditions like diabetes, high blood pressure, or even cancer. Ugly truth. Waiting for symptoms to resolve on their own can result in worsened health. A study from the Mayo Clinic found that delays in seeking care for conditions like chest pain or shortness of breath were directly linked to poorer health outcomes. For seniors, waiting for symptoms to go away can mean missing an opportunity for early intervention. Scientific insight. Early detection is critical for successful treatment. Research from the American Cancer Society shows that when cancer is diagnosed early, the survival rate increases significantly. Likewise, addressing conditions like high blood pressure or high cholesterol early can prevent life-threatening complications like strokes or heart attacks. Actionable tip. Never ignore symptoms, even if they seem mild. If something feels unusual, whether it's unexplained pain, difficulty breathing, or changes in your mental state, seek medical attention immediately. Early intervention could make all the difference. As you age, the way you communicate with your doctor becomes more important than ever. The words you choose to speak, or not speak, can have a profound impact on your health. Avoid these common mistakes, saying "I'm fine" when you're not, rejecting medication without discussing it, avoiding a second opinion out of trust or convenience, not asking for clarification when you don't understand, waiting for symptoms to resolve on their own. By being open, proactive, and clear with your healthcare provider, you'll be taking the necessary steps to ensure that you're getting the best possible care. Your health is worth it, so speak up, ask questions, and never hesitate to seek help when you need it. What's one piece of advice you would give to someone over 70 when speaking to their doctor? Share it in the comments below. And don't forget to like, subscribe, and share this video to help spread awareness about how to communicate better with healthcare providers.